Welcome everyone to today's webinar about ovine brucellosis. This webinar is brought to you by Leading Sheep and the Department of Agriculture and Fisheries. My name is Nicole Salua. I'm a Sheep Extension Officer based in Charleville, as well as the Leading Sheep Project Manager, and I will be your facilitator for today. Our presenter is Dr. Louise Mullemeister, who is a Senior Veterinary Officer for the Department of Agriculture and Fisheries based in Roma. Welcome, Louise.
Thanks, Nicole. All right, if you can all hear me all right, I'll kick off straight away because we don't have much time. So I'm going to talk about ovine brucellosis. I'm just going to give a quick background to brucellosis in general. So brucellosis is the name given to the disease caused by the Brucella family of bacteria. In general, the disease in animals causes reproductive failure, such as abortion or the birth of unthrifty offspring in females, and infection of the reproductive tract and sterility in males. There are several different species of Brucella, of which only 2 occur in Australia. Brucella abortus no longer occurs in Australia as a result of a national eradication program between 1970 and 1989. In most countries, it is responsible for a highly contagious disease in cattle, resulting in late-term abortion and infertility. The disease is also a serious zoonosis, which means that it can affect humans, causing undulant fever. Brucella melitensis can affect most domestic animals, but goats and sheep are especially susceptible. The bacteria causes a severe, debilitating disease in people known as Malta fever. It does not occur in Australia. Brucella canis is known to cause disease only in dogs, although antibodies to this organism has been found in other carnivores. It is zoonotic, but human infections seem to be uncommon, and it also does not occur in Australia. Brucella suis can affect domestic or feral pigs and is endemic in Queensland's feral pig population. Cattle and horses may be infected, especially if they share an environment with feral pigs, although they do not show clinical signs of the disease. Infection has occurred in dogs by eating raw pig meat or byproducts. It is a zoonotic disease causing illness in people, and in Queensland, a voluntary swine brucellosis accreditation scheme is administered by the Department of Agriculture and Fisheries for domestic piggery. Now, Brucella ovis infects sheep and probably occurs in most sheep breeding countries of the world, including Australia. It is an important cause of epididymitis and impaired fertility in rams. It is occasionally associated with abortion and use and can cause increased perinatal mortality in lambs. So that's death soon after birth. In Queensland, a voluntary ovine brucellosis accreditation scheme is administered by the Department of Agriculture and Fisheries, and I will cover a bit more on it later on. So ovine brucellosis, also known as ovine epididymitis, can infect all breeds of sheep, although it can be a bigger problem in British breeds of rams due to increased sexual activity at a younger age compared to merinos. It has been detected in farm deer in New Zealand. Experimental infections have been reported in goats and cattle. However, there is no evidence to suggest that natural infection can occur in these animals. Brucella ovis can cause epididymitis, which is inflammation of the epididymides, orchitis, which is inflammation of the testes, and impaired fertility in rams, leading to ram wastage and decreased reproductive performance. It is occasionally associated with abortion and ewes and can cause increased perinatal mortality in lambs. The effect of ovine brucellosis in a flock is dependent on a number of factors, including the prevalence of the disease or how widespread it is, and the severity of infection. Economic losses due to the disease affect both the wool and sheep meat industries and occur due to decreased semen quality and producing rams that are subfertile or sterile, therefore increasing ram turnover and replacement costs. It can also cause poorer conception rates with an increase in ewes returning to service, reduction in lamb marking percentages, extended lambing periods resulting in difficulties in pasture management and supplementation due to varying stages of pregnancy and lactation cycle among ewes, increased metabolic disorders in ewes and mismothering, decline in wool value due to increased variability in length and quality, variable lamb weights and condition scores causing difficulties in marketing of prime lambs, and it may also cause abortions in infected ewes, although this is uncommon in Australia. Ovine brucellosis is often transmitted from ram to ram indirectly by passive venereal transmission via ewes. So a clean ram can become infected by joining a ewe that has previously been joined by an infected ram. The ewe in this case is considered to be a mechanical vector rather than the actual source of infection. It can also be spread from ram to ram directly by homosexual activity between rams, by inseminating infected semen into the rectum of other rams and licking an infected ram's prepuce. Transmission from ram to ewe can occur, however it is uncommon for a ewe to remain infected. Usually, the ewe mounts an immune response and is able to clear the infection with no further consequences to the ewe or her progeny. In rare circumstances, where a ewe becomes infected following joining by an infected ram, the ewe can develop a placentitis, resulting in abortion, which is the inflammation of the placenta. It can also cause the birth of a normal or weak lamb or a congenitally infected lamb. A question was raised in the webinar registration process about the length of time that ewes can carry the bacteria in their system. As I've mentioned, ewes normally clear infection quickly. However, studies have shown that in rare circumstances, clean rams can become infected following mating of ewes which 4 months previously had been mated with an infected ram but failed to conceive. Another study showed that a small proportion of ewes in an infected flock were infected at lambing and excreted the bacteria in fetal fluids and vaginal discharges. However, 8 weeks after lambing, the ewes and lambs were negative for infection. So it's important to note that the role of ewes in maintaining infection in a flock is complex and uncommon in Australian conditions. Under the Queensland Ovine Brucellosis Accreditation Scheme, it is a requirement of the scheme for ewes introduced from unaccredited flocks that they not be joined for 4 months if not pregnant, or if pregnant when they arrive, that they be lambed in isolation and not rejoined for 4 months post-lambing. Also, that ram lambs born to introduced pregnant sheep be weaned early and tested prior to mixing with other ram groups. I'll talk a bit more about this later on. So in the normal ram, sperm are produced in the testes and are stored in the head, body and tail of the epididymides, as you can see here where I'm pointing. When the ram ejaculates, sperm passes through the vas deferens and collects fluid from the accessory sex glands here and then passes down through the penis and out. So the testes and epididymides should be comparatively uniform in size, shape and texture. Any hardening, difference in size, shape or feel, or any abnormal swellings should be considered abnormal. A general ram breeding soundness examination prior to joining is important to identify a number of conditions that may affect fertility and reproductive performance and should be done as a routine management practice. In rams affected with ovine brucellosis, lesions or abnormalities can occur in the testes, epididymides and in the accessory sex glands. A physical examination and palpation of the scrotum can pick up obvious lesions in the testes and epididymides. The infection first affects the epididymides, causing inflammation and swelling of the surrounding tissue. This creates a blockage, causing further swelling. This may resolve in some rams, so the ram, although infected, may feel normal. In some cases, the testes may also be inflamed. Abnormalities can occur in either one or both testes. So you can see in these pictures here, the green tick indicates the normal testicles. And you can see with the red arrows, in this picture you can see this testy is reduced in size compared to the normal one, and also the tail of the epididymis here is enlarged compared to the normal one, and the same goes for over here. Smaller testy, and an enlarged tail of the epididymis. So, however, it is important to note that not all rams infected with ovine brucellosis will have palpable abnormalities, and not all palpable abnormalities are due to ovine brucellosis. Other possible causes include infections with Histophilus somni, Histophilus ovis, and Actinobacillus seminis, among others. Therefore, clinical examination and palpation alone is not adequate to diagnose ovine brucellosis in a flock, and other conditions causing reproductive losses should also be investigated. So again, if we have a look at these pictures here, the one on the left here, you've got the left testy here is shrunken, and the tail of the epididymis here is also shrunken and hardened. The right testicle here, the testy is shrunken, but the tail of the epididymis here is enlarged. And with this picture over here, you've got the two testicles here, and this here is actually an abscess. So it's definitely important to rule out other conditions. So laboratory testing can be performed to confirm a diagnosis of ovine brucellosis. A complement fixation test can be performed on blood samples to look for antibodies or an immune response to infection. This is the most frequently utilised test as it has a high sensitivity and specificity, which is the test's ability to detect animals that do or do not have the infection. Although the test has a high accuracy, sample collection should not be carried out for less than 6 weeks after the completion of joining due to an increased risk of false positives occurring during this time. Semen can also be collected from rams and used to culture the Brucella ovis bacteria. If there is growth of the bacteria, the ram is infected with ovine brucellosis. However, not all infected rams will shed the bacteria in their semen at all times. So a negative result should be viewed with caution and interpreted in conjunction with other clinical findings such as the complement fixation test or CFT results and palpation. Culture of the reproductive organs collected during a postmortem examination can also be used to determine whether a ram is infected. The entire reproductive tract, including the accessory sex glands and inguinal lymph nodes, need to be submitted for testing. So as I've mentioned, it is also important to exclude other possible causes of reproductive loss through investigating the flock history and monitoring and testing for other conditions that may be present. Queensland does not have a state or regional ovine brucellosis eradication or control program. Ovine brucellosis is not a notifiable disease in Queensland, which means there is no legal obligation to report the presence of the disease to the Department of Agriculture and Fisheries, nor is there any regulatory control over the disease. Most people would be aware of the Bovine Brucellosis and Tuberculosis Eradication Campaign, or BTEC, program in cattle, which ran for 27 years from 1970 to 1997, achieving freedom from bovine brucellosis in 1989 and tuberculosis in 1997. Eradication of these diseases occurred due to the zoonotic risk to humans, production losses in cattle. Bovine brucellosis became the most common cause of abortion in cattle, and to protect and enhance export of cattle, genetics and dairy products. BTEC cost about $800 million and was funded 50% by the national cattle industry, 30% by the state and 20% by the Commonwealth. Drivers for an eradication program for ovine brucellosis would be somewhat different to that for BTEC, as it is not a zoonotic disease, but may be considered by Australia's sheep industry if, for example, protection or enhancement of market access is required. Whilst there is no national eradication or control program, the Queensland Ovine Brucellosis Accreditation Scheme is a voluntary user pay scheme run in association with the sheep breed societies, individual flock owners, veterinary practitioners and the Department of Agriculture and Fisheries. It is a certification scheme aimed to provide the sheep industries with a tool for protecting against spread and consequent productivity losses of brucellosis. It does this by providing industry with an objective system for managing the risk of ovine brucellosis, maintaining a reservoir of Brucella ovis low-risk rams by the usage of management strategies that minimise the risk of introducing disease into accredited flocks, identifying sources of Brucella ovis low-risk rams for those with uninfected flocks who want to avoid introducing infection, for restocking properties that have undertaken eradication programs, and to reduce the risk of Brucella ovis infection being spread at shows and sales. It can also facilitate the movement of Brucella ovis low-risk rams between states and provide objective accreditation for low-risk flocks to promote their health status. There is no regulatory requirement for a sheep breeder to have their flock accredited under the Ovine Brucellosis accreditation scheme. However, some breed societies, show societies and selling organisations may require sheep coming to an exhibition, show or sale to be from an Ovine Brucellosis accredited flock or to have been tested for Brucella ovis with negative results. The scheme is based on a testing regime together with flock and property biosecurity measures that minimises the risk of spread of Brucella ovis within a flock and the introduction of Brucella ovis into the flock. It also uses a series of clinical examinations together with serological screening tests and follow-up investigations of reactors to assess the risk of the flock being infected. So we'll just run a quick poll now, Nicole, if we could.
Sure. Thanks, Louise. So I'm just going to launch this poll now. So you should be seeing on your screen this question, which is about the Ovine Brucellosis accreditation scheme. And if you can just tick whichever of these apply to you. If you've got an accredited flock, you click on the first box. If you only buy rams from an accredited flock, tick on that one as well. Or if you aren't accredited or you don't buy from accredited flocks, please tick on that third box. So there's a few people who have voted, so I'll just give another 5 or so seconds for people to vote. So we've got 5, 4, 3, 2, 1. So I'll close that poll off and share the results for you. So 13% have an accredited flock, 63% only buy rams from an accredited flock, and then we've got 38% who aren't accredited and don't buy from accredited flock.
Fantastic. So that's a pretty impressive result. I think 63 buy from accredited flocks and 13% are accredited. So that's fantastic. So we'll move on now. So eradication of ovine brucellosis involves implementing high-level biosecurity measures and either culling and replacing the entire ram flock or identifying, testing and culling infected animals using the complement fixation test. However, this may not be economical or practically feasible for some properties, particularly extensive sheep flocks where large ram numbers, complete musters and boundary fencing may be a limitation. Therefore, individual properties need to be considered on a case-by-case basis as flock management and biosecurity measures are critical to the success of an eradication program. It may be more feasible in some situations to combine a control program with a staged eradication program with the aim to build up a clean herd as fencing and paddock management improves. Also, some producers may choose to live with the disease but implement control strategies to reduce the impact of the disease. A control program may include using additional rams at joining, manual palpation of rams prior to joining, extending the joining period, regular turnover of rams and replacement with fertile rams, and weaning prior to joining. To improve the success and reduce the length of an eradication program, the following should be considered. Boundary and ram paddock fences should be sheep-proof to prevent the movement of potentially infected animals between properties and paddocks. The ability to obtain clean musters. Individual identification of all rams. You need to be able to ID and test all rams at every muster. Prompt removal of infected rams once laboratory results are received to minimise spread. Avoid eradication during joining if possible. This prevents straying, also for ease of mustering, and avoiding false positives. There's a need to maintain consistent testing intervals. Generally, rams will have a detectable titer on CFT between 2 and 7 weeks after exposure. Therefore, it is necessary to test and cull approximately every 4 weeks. However, this may need to be reduced to every 1 to 2 weeks in Dorper flocks or other British breeds of sheep. The flock is usually deemed low risk of brucellosis when all rams test negative on CFT 7 weeks after the last positive ram was removed, so by achieving 2 negative rounds of results at 4-week intervals. You also need to consider testing of any straying animals onto and off the property, and only buying rams from Ovine Brucellosis accredited flocks or rams that have been adequately tested prior to joining the flock. Although it is uncommon in Australian conditions, the role of ewes in the transmission of the disease may need to be considered if the eradication program is prolonged despite following these measures. However, veterinary advice should be sought before commencing an eradication program to tailor a program that will suit you. For flocks not infected with ovine brucellosis, prevention is best achieved by maintaining good property and flock biosecurity. This includes maintaining sheep-proof fences, particularly boundary and ram paddock fences, maintaining adequate livestock records, including introductions to the flock, lambing and lamb marking percentages, and so on, preventing contact with sheep of an unknown, unaccredited or infected status, including during transport and at sales and shows, having a plan in place to deal with stray sheep onto or off the property, and sourcing sheep from ovine brucellosis accredited flocks, or isolating and testing introduced sheep prior to joining the flock. In an unaffected flock, the main way infection can be introduced is by a breakdown in biosecurity measures. For flocks accredited under the Ovine Brucellosis accreditation scheme, palpation and testing occurs in a sufficient number of animals to provide a high level of confidence that rams are low risk of being infected. This is done annually for 3 years before the flock is eligible for biennial testing for a period of time, and then subsequently triennial testing, based on a recommendation from the flock's supervising veterinarian for the scheme. Flocks not wanting to join the accreditation scheme but who wish to establish a testing protocol would need to consider their level of risk of introduction of the disease and also any potential breaches in biosecurity measures in order to determine a testing interval. And that finishes it off. Are there any questions?
Excellent. Thank you, Louise. So we've got a little bit of time, so we'd just like to spend the next 5 or 10 minutes answering any questions you may have about ovine brucellosis or the accreditation scheme. So while you're thinking about the questions you would like to ask or typing these questions into the question box, I would just like to remind you to fill out our short survey to give us some feedback on this event. You can either click on the link that's in the question box now, or soon after the webinar ends, you will have an email from me with the link to the survey in it. And if you want to know what other events we have coming up, please visit our website, which is www.leadingsheep.com.au. So we do have a question at the moment, Louise, and I think you covered it in your presentation, but you may just want to summarise again. So the question is about why not aim for eradication with ovine brucellosis?
Yeah, so eradication can be difficult for those extensive flocks or flocks that have large ram numbers, and it's just not economical through testing and also through ram wastage from culling the infected rams to do that all in one hit. So I've worked with a number of producers that have had to basically control the disease in a portion of their property while trying to establish sound biosecurity measures in another portion of their property and create a clean flock, and then be able to stage that, build up their flock, their clean flock, while moving from paddock to paddock and establishing biosecurity measures that are adequate for eradication. Because the last thing you want to do is spend a whole heap of time and money on testing and culling, and then have a breach of biosecurity either from a neighbour or from another paddock or from a moving sheep around, legitimate properties, whatever, and then introducing the infection again. So control may be economical for some producers, but eradication is the goal.
Well, thank you. Another question: can you give us an idea of the cost per test?
Depending on which lab you go through, I believe for the Biosecurity Sciences Laboratory, which is the Department of Agriculture and Fisheries laboratory in Brisbane, the CFT test works out at about $12 a test, around about figures, and then there's a lab processing fee of $22 on top of that for each set of samples that you send in. So that's just for BSL lab in Brisbane, but I haven't looked into prices from other laboratories.
Cool. Thank you. Well, we don't seem to have any more questions. I will just check once again and give people another 30 seconds or so. So this is your last chance if you do have any questions about ovine brucellosis. Now's your opportunity to ask them of Louise or the accreditation scheme. So no questions. I can't see any questions coming in the typed box, and no one has their hand up. So Louise, we might just go back to you just to run through a few key points that you'd like people to take away from your presentation about ovine brucellosis today.
So my key points would be that ovine brucellosis can cause impaired fertility in rams, resulting in economic losses due to ram turnover and replacement costs, extended lambing periods, and reduced lamb marking percentages. Routine ram breeding soundness examinations should be performed prior to joining to identify conditions or diseases that may affect fertility and reproductive performance, and this can include things like the ability to see, lamenesses, that sort of thing. Veterinary advice should be sought if reproductive losses are occurring in the flock to determine the cause, and if deemed to be ovine brucellosis, they can help with developing a control or eradication program. And prevention is better than cure and is best achieved by maintaining a high level of property and flock biosecurity.
Thank you, Louise. So I've just got, that's the end of our webinar for today. I've just got a couple of slides to show you, which I'll just bring up on your screen